So in generally, somatosensory origin tinnitus is managed by physiotherapists, okay, because they have certain exercises which are done for the jaw and neck, which will, with that, the tinnitus perception will come down. Okay, so this article will give you information about that. In that algorithm, what they've given is, it looks very big, but nothing to worry here. So this is audiological, this is somatosensory, this is psychiatric. So depending on audiological problem, what happens, where the individual should be referred. Okay. So if you find that audiological evaluations are affected and it is an audiological tinnitus, you need to go for treatment in this direction. Okay. So if it is somatosensory tinnitus identified, what kind of treatment need to be done. Okay. And if it is psychiatric and psychiatric investigation, if you find there is some problems, what kind of management option need to be taken. Basically, this classification tells us about it is not a tinnitus can be of multiple origin. It need not be only from the ear, and whatever be the root cause of tinnitus, try to treat the cause of it. So how do you recommend based on what kind of tinnitus it is? And in this article, as I told, it gives in detail about how to do the assessment of somatosensory tinnitus as well. So a combined, assessment by the ENTs, by the audiologist, and the somatosensory aspect. Then we can say, okay, probably the tinnitus is from, the origin of the tinnitus is this. If we can label that, our management options becomes much easier. So we are done with all these forms of assessment. And one more thing I wanted to tell, different audiologists practice different things. For example, at AISH we follow tinnitus retraining therapy and cognitive behavior therapy. And we have taken specialized training for that as well, in terms of, we are certified to do that. So here, when we do certain assessment also, we have to modify our assessment in a way. I told there are a lot of questionnaires. For example, if you are trying to, your target is to involve the individual in terms of CBT, you have to go for certain questionnaires that are specific for CBT. Otherwise, doing all that again, you'll have to come back and do all this as well. So, you can avoid that. So there are questionnaires specifically for a specific management. So these questionnaires are also free of cost, downloadable. But CPT, it's a program basically. They'll train you for a year, and there are exams and all that, like 2 years to pass, basically saying you're certified to do it. So here, this particular thing, if it is done, these specific questionnaires, if you use it, makes your life easier. You don't have to redo the entire thing for CPT again. So, for example, the questionnaire you say there is a case history questionnaire specific for CPT. Do that, and then it becomes much easier. And one other thing I want to tell you all is in terms of the if you find psychiatric problems or too much of psychological problems, there is a questionnaire called as SAD-T. Okay, this is there. Screening for anxiety and depression, tinnitus, hyperacusis, and misophonia. The last one. It's a very simple questionnaire. There are 4 questions in that. If you administer that question, it takes hardly 1 minute. And if you find that that individual is having a lot of psychiatric problems, psychological problems, if the score comes beyond 6, refer them to a psychiatrist or a psychologist so that they also be a part of the management. So if they are involved, it's not that our job is over. We have to do our management as well, take support from them as well, so that the entire individual, the individual as such is getting benefit from the entire management option that is given. So this is the idea I wanted to give in terms of overview and assessment of how audiological assessment is done. Okay, I'll continue with the management also in the next lecture.
As a take-home message, can we suppose that the basic test which will help us is the Peotron audiometry and
extended high frequency audiometry?
The Newman's questionnaire is the most important.
Sir, in terms of, yes, if you want to quantify tinnitus, we need to have some values, something. Like in a blood test we have certain parameters, we have some score. So like that, if you want to quantify tinnitus, the pitch matching and loudness matching need to be done. So that gives an idea about, what is the values that he is getting in terms of perception. That's for the audiologist or the ENT point of view. And in terms of the quality of life, yes, we have to go for one of these questionnaires so that we really know how much the life is affected in the individual.
And lastly, about the certification regarding CBT, who does it?
In the UK, there is a program, sir. In India, it is not there. And they are doing it online now. It's a 1-year course that they do it. And we have every month supervised sessions. we have exam, we have, a lot of things, a lot of assignment needs to be done. At the end, they will verify everything and then, they tell you if you are passing or not. It's like that. And they have, checked the efficacy of audiologist given therapy versus psychologist given CBT. And there are a lot of articles coming in that line as well, like, how is the benefit, is it really beneficial or not? So that.
Only by questionnaire we have to survive, whether it's psychological or somatosensory or audiological.
No, sir. In somatosensory, we have certain maneuvers that need to be maneuvers. Yes.
For the management.
Yes, not management, sir. For assessment as well.
Assessment.
Sir, for example, if there is a jaw-related problem or a neck-related problem, certain maneuvers, like in when we do, the perception of tinnitus varies. What the individual is perceiving at that point of time, when during that maneuver, for example, you turn your neck and hold it for some time, the perception of tinnitus varies. At that point of time, it is understood it is most likely a somatosensory tinnitus, and then the corresponding management option can be taken up.
What about the tinnitus handicap inventory questionnaire, which is available in other languages? Does it have to be?
It is standardized, already published. Already published ones are available.
Okay.
So we can.
Does it have to follow a certain protocol to standardize the?
Yeah. The standardization is the entire process, a big process, right? It is not just translating the words into it. We have to administer it in a large population. Then to check for the efficiency of the questions. We have to do a reverse translation, seeing if that translator is really going to assess that. So it's a standardized procedure what is followed, and then we have it in already major languages, so it can be utilized. It's already available.
Certain cases in Kyoto audiometry, in the audiogram will be seen that lower frequencies, mid frequencies, it's like normal, it didn't take maybe PTO. But when we go to 4 kilohertz again and 8 kilohertz, especially 8 kilohertz, it will start giving. It will be like slopping kind of. So these individuals, they don't report of having tinnitus as such, but I already in a group of very adults like 30 to 45. They will sometimes say that once or twice in a month they will be having tinnitus, like maybe 3 or 4 second duration. So do you think we as an audiologist we should do the extended high frequency audiometry, check all those things?
For an individual with short duration tinnitus?
Yes, short duration of tinnitus, or how we should counsel them, or do the assessment if they are saying usually frequently I had this attack kind of, it's not and it will be kind of what we discussed in IDL and all those things, like the tone of confusion, what you were saying. So similar way, it will start from the right ear or left ear and it will go into the left ear, and it will be from high to low. So what should we do?
Short duration tinnitus, the best recommendation is ignore. Ignore the tinnitus. See, when they come to us, they have already done enough of doctor shopping. Generally, they go there are people who have done 1 year, 2 years. They've gone to multiple places. There's no benefit. They'll come. See, when every time they find a person who is able to treatment is not beneficial, they get more and more worried about it. Okay, so the first instance, the first best counseling is to say, it is not a bothersome thing, or it is not something that need to be bothered. For example, I told some time back about the reactions that can be there. Our task is to make them understand that these reactions are the one that is causing the tinnitus. It's like, I'll give you examples in the management. For example, you take this room, and now it is like so many lights are there. You turn off the entire light, lit a candle in the center. The light, is sufficient enough for seeing something, right? So now what will happen? If you turn on all the lights and lit the candle and keep, what is going to happen? You're not focusing on the candle light at all. You won't even know such a thing is there. Sometime back I told about the snake. Correct? It is like that. So when we are, talking more and more about tinnitus, the tinnitus become more and more stronger in the individual. Okay, that tend to become more and more aggressive in that person. Okay, that person tend to feel, okay, this is really causing my life to be affected. So the best thing to do is, try to make in a way that the individual is not affected because of it.
So can we refer them for CBT because they will be in high likelihood of having probably anxiety or depression?
See, that depends. If you think, one counseling, a background enrichment is not going to be beneficial, See, what are we trying to do in CBT? Basically, we are trying to generate counter statements in them. What do you mean by counter statement? The counter statement is like, okay, now I am not able to sleep with tinnitus. So what I'm going to do? I'm going to generate counter statement in a way that, okay, tinnitus is there. It's not that I'm not able to sleep. With some time, okay, I may struggle, but eventually I'll sleep. It's not that tinnitus people won't sleep at all. It's not possible for anybody to stay awake throughout, right? One day they may not sleep, next day they'll sleep. So basically, you're trying to make their views stronger in terms of, okay, I'm having tinnitus, but I can live with it. We are not going to take off the tinnitus. Tinnitus taking off is not possible, except in genetic causes. Okay, as I told, till now there is no intervention as such that has come up in genetics and tinnitus, but in the future it might come up. Okay, that is when you identify a gene, treat the gene, which is affected. That is the only direct treatment. Or if there is an ENT management in terms of, see, for example, there are individuals where wax is blocking the tinnitus, causing the source of the blockage. The peripheral output is going lesser to the inner structures. If that is affected, you get a clearance done. So many a times that will, be the reason for it. For example, there is a vascular problem, blood supply, it's affected. There is something compressing the blood supply. Get a management done in that line. So that will go up. So that way, if you can manage, that is the best thing to do. So don't make the tinnitus to be more and more bothersome. That's the first and only thing that you have to do initially. If you think, that won't work, then go with the management. I'll tell you about that in this. Okay. I'll try to keep it as short as possible. So now going to the last topic, that is the management of tinnitus. Okay. So now psychoeducation counseling is the first and the foremost thing. As I told, I don't know about the efficiency of medicines that the doctors prescribe, whether it is given and it goes off. I don't have much information about it, but if that is not working, what else can be done? Okay. So now, general and auditory, we have to talk in terms of the anatomy and physiology of the ear, explain to them, what is the source of generation of tinnitus in the way they can understand. That is the most basic thing, For example, I say CBT is the way of management. I'll tell you, CBT individuals who are educated only stay back. Others won't stay back at all because, so many patients we see in Aish, if they're not educated enough to understand the concept of understanding, living with it and all that, they don't stay back. After one session, they will never come back. So level of education, level of understanding about the condition, all those things matters also. So what I'm trying to say is you have to, in the way that they can understand, we have to talk in terms of anatomy and physiology of the ear, how the sound is perceived, and then explain about the audiological findings that you've got. So this is the audiological or ENT finding, whatever is there, explain it to them. And in terms of cognitive aspects, we have to talk about habituation. Most of the audiological management talks in terms of habituation of tinnitus. As I told, you cannot treat the cause of the tinnitus. What we do is get the individual habituated to it. What is the habituation? Getting used to it. Okay. So live with tinnitus. That's the basic thing we can say. Live with how to live with tinnitus. Okay. Then attention factors, self-management or coping strategies, what need to be done. All these things can be counseled. And then we have to talk to them in terms of management. What are the management approaches that you're going to be using? And how to prevent the relapse. Relapses, again, it is going to be taking up. Okay. Okay. So these are the strategies that need to be used in terms of handling the individuals with tinnitus. This is called the SMART strategies. So now the sleep hygiene. So sleep hygiene. See, most of the times tinnitus is bothersome when the individual is going to bed. Okay. Otherwise, when the person is occupied, being with the family, being at work, most of the time tinnitus is not going to be bothersome. So now the first and the foremost thing is going to bed strategies. Okay. So here, most of the people have a bad habit of going early to bed. I won't say going early is bad, but in terms of individuals who are affected with tinnitus, they should go to bed if they're really tired, really sleepy. Until then, they should be involved in some activity. That's the first thing to do. If you go very early, okay, jobless, you just look at the roof and then try to think about more and more about tinnitus, your perception will become more and more enhanced. So that is the going to bed strategies. Falling asleep strategies in terms of what are the activities that can be done to fall asleep. For example, you get more tired, do exercises on a regular basis. All those things are going to help in that. Sleeping environment should be comfortable. Okay, there should not be much disturbances in sleep. And daytime habits also has a significant role in terms of sleep. So all these things you have to tell in terms of make them understand how to get a better sleep. Okay, that is sleep hygiene. Relaxation techniques, we can force them for progressive muscle relaxation. So this is one area which is getting explored in detail. So progressive muscle relaxation is for example, I'll say, okay, now, move your leg like this and feel the muscle tension. Okay, hold it for a few seconds and then release. So you are trying to make the individual understand the muscle relaxation that is happening by doing it on purpose. Okay, I say you sit straight for some time. Okay, stretch your back properly, hold it for 5 seconds, then release, then you will feel that comfort, right? So that way we are trying to make the individual to train that person to relax or loosen the muscle by themselves. So deep breathing exercise. Google, if you open deep breathing, you give, Google itself will show, okay, now start breathing, that light will become bigger and bigger. Now you release, it will become smaller and smaller. These are the techniques that can be used for relaxation. So attention control techniques and distraction, okay, we can train them to, control their thoughts and attention towards certain activities. And also we have to tell them about communication strategies in terms of hearing loss. Communication tips needs to be given, in terms of wearing hearing aids, in terms of, how to enhance the communication. All those strategies can be given to them. So when we talk about counseling in terms of tinnitus perception, we need to tell in terms of what is happening here. So here, in terms of a sound, so there is a sound that is having a frequency, time, and intensity. It is encoded in the cochlea. Feature extraction takes place. Feature extraction analysis takes place. Object construction takes place, and then finally you perceive the sound. But in tinnitus, what is happening? There is no sound. None of these are happening, but you're perceiving the tinnitus. So you have to counsel in terms of what is the difference in terms of sound perception, what is the difference in terms of tinnitus perception. So make the individual understand that all these components are not there in terms of tinnitus perception. It only happens if there is a real sound in the environment. So there is Rubin's vase. I know, most of you are aware. So what is that first figure indicating? Can anybody see two faces there? Yes. And in the center you can see a vase, right? So it is like shifting the focus from vase to the face. Okay. And in the right image you can see, if you can see in between in the crosses here, you can see a gray shade. Yes. Is that real? It is not real, right? It is not real, but you're perceiving it. So tinnitus is something like a phantom activity. Okay. So something like this, what is there? But what is your task? Your task is not to concentrate on that particular thing which is not there. Your task is to concentrate on things what is more evident. So you're trying to shift the focus from tinnitus to what is the focus, what is really need to be given. So this is classic ways in which you can explain the individual about tinnitus is a less important thing. And along with this, you can use the candle light example, which I told some time back. Dark room with candle lit, bright room with candle lit. So your task is in terms of enriching the background in terms of you are always keeping the light more in the room so that the focus don't fall on the candle. So candle light is the tinnitus. Okay, so this is one strategy you can use to make them understand. For example, they're finding it difficult to fall asleep because of tinnitus. What they can do, they can play some melodious songs, whatever they like, in a volume that is comfortable, so that the background is enriched, so they don't listen to tinnitus much. So that is what is basic idea of background enrichment. So now metrics for the audiological management. So here you can see this is avoid silence and all. These are the simple strategies, and there are other strategies like hearing aids, combination instruments, even cochlear implants, and advice is given, biotherapy, directive counseling, psychoeducation, psychological referral. So now, for example, normal hearing but fears tinnitus. So is an individual or a person who can be going for a directive counseling, okay, along with environment enrichment strategies. That would be sufficient. So now if you take an individual who is having hearing loss but low psychological impact, then you have to go for hearing aids along with the other management. This is just a matrix which tells you what to fit in for that particular individual to be selected for management. So now you see this. So you have significant anxiety, depression. So we don't try to manage them. We try to manage them along with the support from a psychiatrist or a psychologist. So there they require a psychiatrist or a psychological referral. So different categories of tinnitus, we have to handle them separately. Not all individuals require the same form of management. Okay. You don't recommend CBT for everybody. You don't recommend TRT for everybody. For certain individuals, for example, there is a peripheral hearing loss. The first and the easiest thing to do is to fit with the hearing aid and see if the hearing aid is going to reduce the tinnitus perception. Sometime back I told the basic reason for tinnitus is the peripheral structures are not giving proper information to the higher center. When you just give a hearing aid, at that point of time, the perception may become better. Because the peripheral loss, what is there, is compensated by the hearing aid. Hearing aid will enhance it, amplify it, and give it to the higher centers. So basically, whatever loss was happening in the periphery, it is becoming lesser at a higher center. For example, at the level of cochlear nucleus. The cochlear nucleus is getting a sufficient input, then there is no requirement of over enhancement. So the first thing, if hearing loss is there, hearing aid, at least in 50% of the cases, wearing a good hearing aid will reduce the tinnitus perception as well. Okay, so that is one thing. And now the options available, lot of options are there. Hearing aids, cochlear implants, sound therapies, residual inhibition, TRT, neuromonics, notch noise, TDCS, binaural beats. I'll just give a brief about these therapy options what are available. Okay. And as I told some time back at Aish, we practice two. One is TRT and other one is CBT. These are the two techniques that we are following. There are 2 or 3 people we are working only in the area of tinnitus. So we generally recommend this and administer this. So that is what we seem to be giving more benefits. So hearing aids, yes, I told some time back the sensory deprivation is there. So what is the hearing aid doing? Hearing aid is again enhancing the deprivation what is there that is happening because of a peripheral problem. So when this happens, obviously at higher center there is an enhancement, and obviously your loss what is there that is compensated by the hearing aid itself. And it will help in improving communication, and you can also give sound therapy or tinnitus maskers. Now there are combination devices. Those are called as combination devices, which along with hearing aid, it has features for tinnitus masking as well. So you give masking along with the hearing aid usage. So that is going to help the individual to overcome that. So hearing aids is one good option if there is hearing loss associated. As I told, at least 50% of the individuals benefit clinically when we fit with the hearing aid. That is in terms of hearing as well, 50% in terms of people benefiting for tinnitus relief. How? It helps in auditory stimulation, it helps in sound enrichment, it helps in